The condition I treat pretty frequently is a condition called femoral acetabular impingement or labral tears in the hip. A lot of times people describe this as a hip flexor injury, and a lot of times that's what people actually think is going on, is a strain to one of the flexors in their hip joint. Unfortunately, a lot of times below that is an injury to the hip joint, and what that really is a condition where patients have a congenital prominence in the bone and the ball and socket joint in their hip, and when they flex their hip repetitively over and over again, often seen in athletes, that can tear the soft tissue or the cartilage that surrounds the socket in the hip. So this is a new and budding area in orthopedic surgery. The treatment options years ago really were only an open procedure, which would require, unfortunately, a large incision and a lot of rehab for the patient. Since then, we've really come a long way as far as the technology and the treatment options, both surgically and non-surgically. If it does require a surgical intervention, we can now treat this injury through the arthroscope, which is really 3 tiny little incisions where normally this would be a very large incision and ugly scar. This can be quite pretty and the patients recover very quickly. The great news is we can make you better. Traditionally, hip pain in a young athlete was a very scary area for orthopedic surgeons because we just simply didn't have the means to treat it. Now we can get patients back and get them doing the things that they want to do. We can do that very rapidly. It's usually around 4 months post-operatively. We can get patients back on the ice, back on the field, and they're doing great now.